Not a guest or you are not a visitor. Yes, you are a guest, but you are not a visitor to KDRTV studios. And we are really happy today to have you because we have a very hot topic right now, especially in the African immigrant community. And we need at least to have a highlight or a few details or some advice to our community about the AIDS pandemic. Yes, we have the COVID pandemic, but we have another silent disease called AIDS or HIV AIDS, which is also common amongst our African community. So once again, welcome to KDRTV studios.
Thank you.
Welcome.
Brother Bernard.
Thank you very much. So Pastor, a few questions we would like to ask you today. One of them is, how are you as a church minister or a pastor helping those people who are affected or infected with AIDS? Because we believe and trust that some of them are your members, either in the community, in the larger African community, or even the church, in the church you're serving.
Yeah, thank you so much. First of all, allow me to say that my name is Dr. Leakey Nyaberi. I am the pastor of United Central SDA Church and the Mountain Experience. I have been in this community for 3 years now, and yes, HIV and AIDS is a silent killer because it's basically a private disease. Just like many diseases are private, HIV is no exception. And rarely will you find people coming to converse with you and to tell you that I'm HIV and AIDS positive. But those who come, we treat their information very, very confidentially, because that is the moral thing to do. It is the right thing to do. And maybe somebody is overwhelmed by stress, being depressed because of their condition. We encourage them, we point to them where support is, and we pray for them. And we tell them AIDS is never a death sentence. They will be able to live their full lives. And we also, basically we encourage them and point them to where they can find support.
Thank you very much. At least it's good for us to hear that at least they open up to you guys, and you also actually direct them to the places where they can get the help they need.
Yes.
Thank you very much. Now, are there any challenges, especially from the other members who may not need to reveal that information to you? So those kind of members, how do you really manage to reach them, or which methodologies do you actually employ to ensure that they are helped?
A pastor is not a center of treatment.
Know that. Yep.
And therefore, I really don't encourage people to come to me. My role is to give information, to tell the membership that there is this disease, this is how you can get it, this is how you can prevent it. If you have it, this is what you need to do in order to get help. But if somebody in the process of me passing that information comes to me and tells me, I need to share with you something, I treat that very, very confidentially and in the process of helping them. But I don't encourage anybody coming to me. They have the health facilities, and that is basically what we need to do. There were days when a pastor was carrying everything.
Oh, sure.
You became the mental health practitioner. You became the counselor. You become everything.
Sure.
But in America, where we are, those facilities are available. And therefore, our role is to point them to where they can find help. And in most cases, they are primary care doctors are always the best bet, because they know their secrets, they know their medical secrets, they will know where they will direct them. So the major thing is point them to their primary care doctor, who will look for these facilities for them.
Okay, thank you very much. What I've actually got from you is AIDS or HIV/AIDS is not a death sentence. That is a very good. That is a very good note from you, Pastor or Dr. Leakey. That is the information actually we need to go out there. That it's not a death sentence. There is a way somebody can actually get help. And we are really encouraged that you always point them to where they can specifically get help. So anybody who is watching right now, anybody who's getting this information, the best option is for them. Basically, they can confidentially contact you or connect with you so that you can direct them to where they can get the help. And again, you said that the number one contact is their primary health care,
yes,
which is pretty good for them to hear that one. And then the other thing is, we've got community self-help groups around here. I don't know whether you know, but you know, we basically came to interview because you are a church. You lead a huge delegation, not only a huge delegation, but most people call you the community pastor, the African community pastor. That's actually why KDRTV is here to talk to you. So the other thing we would like to get from your end is that if these people want to reach you, can they still come to the church, or where can they actually get you?
Well, allow me to say two things. Two or three things. One, it is true that HIV and AIDS kills. Once you contract it, if you don't take care of yourself, if you don't seek medication, you will surely die. You will surely die. Mm-hmm. So AIDS kills.
Yes.
Just like malaria can kill if you don't get medication. But you know, when somebody contracts this disease, it is not the end of the world. That is the message. You don't just throw your hands up and say, oh my God, I'm HIV positive, I'm done. Mm-hmm. No. You can live your full length of days that God gives you. That is number one. But you need to take care of yourself. You need to eat well. You need to seek treatment, because there is treatment. You need to have a positive attitude. You need to have a strong set of friends who can be able to give you the social support, the spiritual support that you need. That is key. Then I also want to say that I'm honored to be called the Kenyan community pastor. Mm-hmm. And I am here to help our people and to give the people the support. Mm-hmm. For the last 6 or so months, twice a month, mm-hmm, I have been having a segment, a 15-minute segment in the church that talks about HIV and AIDS. We are partnering with a group that is called Sub-Saharan African Youth and Family Services in Minnesota. They are based in St. Paul. And so they facilitate us to be able to train our members on what HIV and AIDS is, how you can get it, how you can avoid getting it, what to do when you get it, where to go when you get it, and all these things that are meant to help you survive the disease or avoid getting the disease. So we are targeting youth, we are targeting families, we are targeting the divorced, we are targeting all sets of people within our communities, and especially within our church. Thirdly, I am available. I have an office at United Central SDA Church. Just Google United Central SDA Church. My email is Leakey, Leakey, MN like Minnesota, MN @gmail.com. You can shoot me an email. Ensure, as the son, you should be able to find me, and we can talk more about that.
Thank you very much. Another critical aspect you have actually talked is about nutrition. So do you have any other segment, especially when you're talking about the AIDS, and the segment whereby you tell the congregants or whoever is actually sick or who is infected by AIDS, or having a family member who is having AIDS, on what the routine they're supposed to take, especially when they are eating their meals, or what they really need to eat?
No, we refer them to a nutritionist who is able to give them the correct dietary requirements that they need for their health. I mean, you know, food is food. All you need is a balanced diet. All you need is quality, balanced diet of food. And as long as you are taking your medication and you're eating well, you're good to go.
Perfect. Oh, that is great. That's great to hear from that. So what I'm actually taking from here again today, I still insist on it, or continue repeating it over and over, is that it's not a death sentence. There's help. You can get medication, but if you don't get those medications, you will surely do what? Die. You will surely die. That is the other thing. And then, I mean, if somebody is infected or affected, what would you like to encourage them to do? Because, you know, to some people, I remember I worked in the medical industry for over 15 years before I relocated to the United States, and I was actually seeing how rampant, or I mean, how the disease was ravaging our people. It was actually killing our people so much. And you know, some people who are very healthy, immediately they get the results, they just collapse. You know, they just collapse, they stop eating, they stop taking medications. There are some people also who might not actually even, the regimen of the treatment they get does not actually work on their way, and you'll see them deteriorate, and a few months down the line they're actually gone. So what advice do you actually now again tell them as we are closing this particular interview session?
You know, research has shown very clearly that the Center for Control of Diseases, the CDC, has worked very hard together with the researchers to find that which works. And therefore, there is medication that can, you know, work with your whatever immunity needs that you have to be able to handle your situation.
Yes.
One other aspect that I want to say is a lot of people look at AIDS as a shame disease. Maybe I got it because I was immoral. Maybe I got it because I was not faithful. But knowing that you can get AIDS in an accident by mixing of blood, mixing of fluids, you can get AIDS. You can get AIDS by injecting yourself with used needles and syringes.
Yeah.
So
even when you are caring to patients in the hospital,
yes, even when you are caring to patients and you're not using gloves,
and most of our people, and a good number, young number. Let me not be very specific, but they say that almost 82% of the African immigrants actually work in the health sector. We'll do the start some other times, but that is a rough estimate, they say. Yes.
An endangered species.
That is true.
Because they interact with patients day in and day out.
The good term is they are exposed.
If you have a wound, and maybe your gloves are broken, you are likely to be infected. And therefore, when you contract AIDS, don't look at yourself as a sinner. And even if you got it because of immorality, who tells you that you cannot be forgiven? God is in the business of forgiving people.
Amen.
And so nobody should feel ostracized or demonized, or, you know, what is the best word to use? Stigmatized.
Yeah, stigma, yeah.
And we try to tell people that do not look at people and categorize them as sinners, as no hope. Look at these people as people who have been created by God, who are God's children, who are here to contribute to the well-being of society. And once you are in this situation, you can still contribute. And therefore, live your life, be happy, but get medical help.
Thank you very much, Pastor. And on a closing shot, I would like also you to advise the community on how they can also prevent themselves from infecting the other people. Which methodologies do you want? Let's not go to the medical. I don't want you to go there. You are a spiritual leader. But the best option is how would you like your members actually to treat, especially those people who have contracted the disease? How do you fight stigma and all that? Let's just leave the medical aspects out of it. So don't worry about it.
Wanting people to know that anybody can get AIDS.
Yes.
And as I have said, that AIDS is not a death sentence.
Sure.
And AIDS does not stop you from serving
Sure.
in the church or in the community.
Yes.
AIDS does not really hurt you in any way. Yes, it is true. It denies you certain things in this life. But there's no need for us to stigmatize those who have been affected. We need to love them.
Yes.
We need to support them.
Yes.
If they call you for a party, go and have fun.
Sure.
In any case, how do you know that the party you went yesterday, that person is not infected?
Sure.
And so you can hug, you can greet each other.
Sure.
You can live a normal life with it. So there is no need to look down upon anybody, to stigmatize anybody,
Yes.
because basically we are all human beings.
Thank you.
And we need to love and support one another. Just like if somebody has cancer, they need that love and support. People who have AIDS also need that love and support. So you also asked me, how can we prevent HIV and AIDS? You know, the best method that they say is those who are married, those who are not married, those who have girlfriends, stick to one partner. Each of you should be faithful to one another. Then don't, you know, involve yourself in drugs and alcohol, abuse, because when you are in this condition, you are likely to be compromised in terms of your thinking.
Sure.
And this can lead you to do something that can hurt you or harm your health. Or expose you to situations, yes, that can give you the disease. We also encourage young people to use protection. Protection is available both for female and the male. If you really feel that you need to have sex, then you must use protection. Then go for regular testing. Go for regular testing, know your status, and once you know your status, seek help so that you can get to be treated, live a long and happy life. Then once you know that you are infected, don't say that I don't care. You need to care for your family, you need to care for the people around you, you need to care for your community. You need to stay safe so that others can be safe. Just like we are saying, put on your mask, yes, so that you are safe and you make others safe. Yes. So also, okay, HIV.
Thank you very much, Pastor.
And AIDS.
We appreciate for you. We appreciate your time. We appreciate your dedication to the community, and thank you for those kind words. Thank you for that information. And those who are watching, you've actually heard it from Pastor himself, Dr. Leakey. Stay safe. Everything works good if you understand exactly how your life is. The other thing you need actually to do is go for tests, know your condition, know your status, and stay safe. Thank you very much. May God bless you, Pastor.
Thank you.
Welcome.
Thank you for coming.
Thank you very much.
Have a good one.
Thank you very much.